Good morning. 17 September 2024 is considered as World Patient Safety Day. It is an initiative that is taken up by the WHO in order to promote global action on patient safety, which is mainly grounded by the fundamental principle of medicine, that is, first do no harm to the patient. Get it right and keep it safe. That is the objective, that is the motto. That is, make sure that your diagnosis is proper, which is of utmost importance, so that it is found that almost 16% of the cases there has been error in the diagnosis, which leads to untimely delay in the treatment and which may cause harm and may affect the safety of the patient. So it is important to raise global awareness on the errors in diagnosis and therefore which will indirectly contribute to patient harm. So foster collaboration with other healthcare leaders, other stakeholders and healthcare workers so that we can work hand in hand to find a correct diagnosis so that the safety of the patient can be ensured with proper and apt treatment. Empower the families of the patients and also patient attenders should be involved in actively managing the patient, and they should be at the upfront in engaging them with the day-to-day activity, day-to-day outcome, or how the patient recovers from any health problem, so that they will be aware of the day-to-day activity that is going on in the hospital, so that they will also cooperate in the outcome and successful treatment of the patient. And also, it should always be a teamwork in collaboration with the patient attenders, and also with the healthcare workers, so that the outcome of the patient can be effectively managed and better healthcare can be provided to the patient. So first and foremost, we should always make healthcare safer. All this will lead to a healthy outcome. So this is of utmost importance that healthcare providers and all the stakeholders, they work hand in hand to promote patient safety, to prevent any untimely complication, untimely treatment errors, so that the diagnostic errors can be avoided and healthy outcome can be ensured. Thus, it is important that all the stakeholders, as WHO invites all of us to light up the world in orange on 17 September 2024 to work towards a single step, that is realization of diagnostic safety, and thus promoting patient safety and improving the healthcare. Thank you.
Hello, I am Dr. Jayakumar, physician from the Department of General Medicine in Kasturba Medical College, Bangalore. So, the theme this week for the patient safety is improving diagnosis and ensuring patient safety. So, how does correct diagnosis and timely diagnosis is related to patient safety? First, coming to correct diagnosis. Correct diagnosis ensures correct treatment, and that in turn ensures safe patient outcomes. It also ensures improved health outcomes. And not only that, it increases the patient trust in the diagnostic process and hence improves the final outcome for the patient. The second part is the timely diagnosis or early diagnosis. So we always try to ensure early diagnosis, and how does that help the patient? It helps in early recovery, and finally it also has other benefits like decreased health care costs. And overall, both these in the patient requires patient participation. So whenever there is active patient participation, it ensures that the correct diagnosis, correct treatment can be continued, and patient will be compliant in treatment and follows it for a long period of time. And finally, all these three make sure and ensures that the patient outcome results in a better outcome for the patient.
Hello, I'm Dr. Jayashree, pediatrician. The theme for this year's World Patient Safety Day is on improving patient safety, based on the slogan, "Get it right, make it safe." Correct and timely diagnosis is the step to preventative interventions and effective treatment. Department of Pediatrics at KMC Hospital, Athawar ensures that the child is diagnosed early with immediate treatment initiation, so that the child's disease is under control or the progression is halted early. We follow a transparent one-to-one discussion with parents about the illness, diagnostic testing and treatment of their child. We collaborate with other departments whenever needed for the diagnostic testing and treatment of the disease of the children so that the children receive best pediatric care under us and sail through the difficult period. Also, get back home happy and healthy. We always believe in teamwork. We work together with parents or caregivers, faculties of different departments, junior residents, nursing staff, hospital management, and other stakeholders so that we can adhere to the patient safety policy and we are able to minimize the uh, errors and provide best healthcare to our patients.
Hi, I'm Dr. Vijay, intervention cardiologist from Kasturba Medical College, Attawar, Mangalore. On behalf of World Patient Safety Day, the theme is this time is uh, get it right, make it safe. So, first point is correct diagnosis. In any disease, any department or any disease, the first thing is you're making a correct diagnosis. It helps in patient it helps to patient recover early. So by giving the proper treatment and early treatment, and patient go home safely. Other point is getting the correct diagnosis and timely diagnosis. So if getting a correct diagnosis with timely diagnosis more important. If for example if you get the diagnosis earlier, so it will be easier to treat in a, earlier stage of the disease rather than patient one goes for the advanced stage. So it will be helpful for recovering for the patient. And with timely and correct diagnosis, we usually collaborate with the other departments, like for example any scan is required, CT scan, MRI scan, ultrasound, we collaborate with the radiology department, and any labs are required. So pathology department or microbiology department is, it will be helpful for currently diagnosis and timely diagnosis. And once this correct diagnosis and timely diagnosis help for the patient benefit, like in hospital stay reduces, financials come down, mortality reduces, morbidity reduces, and prognosis also is better. Thank you.